Hi, I'm Dr. Meera James, consultant cosmetic dermatologist and MD Boyesthetica Academy. And this is Dr. Darshana. She has been with me for the last few weeks getting training, that is especially hands-on training in injectables. So what was your experience, Darshana?
It is a wonderful experience. Actually, I think this is the best decision I had taken after my post-graduation.
Happy to hear that. Okay. Yeah.
So, since you already know, I was working in a cosmetology clinic. So, I was doing basic injectables. So, initially, I was told that the training will have benefit in my practice. But after coming here, my perspective, everything completely changed. It was a very new thing. It was an eye opener. Usually during ma'am approach is very different.
Okay.
You have a patient centric approach. That is, you'll plan according to the patient features and then their concern. And that was a very new thing for me. And with the minimal injectables, you are doing it you are delivering the maximum good result to the patient.
Thank you.
It was a very new thing, and I'm glad that you are my trainer.
Thank you. Because that is what I personally feel, because in India our patients do have a budget constraint. So many of them are not ready to spend that much on these kinds of treatment. Of course, there are some patients who are ready and there are some patients who are not ready. So when we learn to combine the various injectables like the thread lift or the fillers or the botulinum toxin, then actually the amount of these products that we use are much less, and as such the budget for the patient also becomes less. So my aim is to teach to combine these injectables to the optimum level. So I'm very happy to know that you could learn that. Okay.
Ma'am, do we use same threads in all patients?
There are different kinds of threads. There are simple video threads, there are screw threads, there are double screw threads, and these threads again are of different lengths. That is, there are 50 mm long thread, 60 mm, 70 mm, and even 90 mm. So depending on how wide is the patient's face, that actually determines the length of the thread that we use. So if a patient has a very wide face, we can even use 90 mm threads, but they are not that commonly available in India.